Why do I feel like closing my eyes while concentrating? Why is it getting difficult for me to watch television? Is it something serious? How do I get permanently relieved from this problem? These are few questions that come across the minds of people when they suffer from dry eyes. Yet, there are many queries that are yet to be entertained. That is what we are going to do in this video. Hello everyone, this is Dr. Shweta Jain from Eye Mantra Hospital. As you all know, we usually talk about eyes and the problems related to eyes in our videos. This time I'm here with another problem called dry eyes or dry eye syndrome. In this video, I'm going to tell you each and everything about it. I'm going to cover the following aspects. What is the meaning of dry eyes? What are the symptoms of dry eyes and how does it feel to have a dry eye in morning and in evening? What are the causes of dry eyes? How do you diagnose it? What are the home remedies and diet supplements that can treat it? What are the clinical treatments available for dry eyes? And lastly, what are the risk factors associated with it? To begin with, I'll tell you the meaning of dry eyes. Your eyes don't generate enough tears or can't maintain a regular coating of tears to coat your eyes if you have dry eye syndrome. Bacterial infection may develop in your eyes or the surface of your eyes may become inflamed, resulting in corneal scarring. Dry eye condition virtually seldom result in permanent vision loss despite how painful it is. It has many evident symptoms like burning, pain, redness, stringy mucus, eyes get tired faster than they used to, difficulty reading or sitting at computer for long periods, blurry vision, the feeling of having sand in your eyes. All these symptoms are felt when there is a chance that you might have dry eyes. Evening dry eye is usually the result of whatever was done during the day. So if you are staring at a computer or a book all day with reduced blinking, then the eyes will feel drier at night. By maintaining adequate ocular surface hydration throughout the day, symptoms may be better in the evening. If you go to the doctor, he'll first examine the cause of dry eyes and then decide on the treatment. You must know about the various things that may cause dry eyes. Tears have three layers. There is oily outer layer, the watery middle layer, and the inner mucus layer. If the glands that produce the various elements of your tears are inflamed or don't produce enough water, oil, or mucus, it can lead to dry eye syndrome. When oil is missing from the tears, they quickly evaporate and your eyes can't maintain a steady supply of moisture. The causes of dry eye syndrome include hormone replacement therapy, exposure to wind or dry air, such as constant exposure to heater during the winter, allergies, LASIK eye surgery, some medications including antihistaminics, nasal decongestants, birth control pills and antidepressants, aging, long-term contact lens wear, staring at a computer for long hours, and not blinking enough. So moving ahead, let me tell how does the doctor diagnose dry eyes in a patient. Tests and procedures that may be used to determine the cause of your dry eyes include a comprehensive eye exam, an eye exam that includes a complete history of your overall health and your eye health can help your doctor diagnose the cause of your dry eyes. A test to measure the volume of your tears. Your doctor may measure your tear production using the Shermer test. In this test, blotting strips of papers are placed under the lower eyelids. After 5 minutes, your doctor measures the amount of strip soaked by your tears. Another option for measuring tear production is the phenol red thread test. In this test, a thread filled with pH-sensitive dye is placed over the lower lid, wetted with the tears for 15 seconds and then measures the tear volume. A test to determine the quality of your tears. Other tests use special dyes in eye drops to determine the surface condition of your eyes. Your doctor looks for staining patterns on the cornea and measures how long it takes before your tears evaporate. A tear osmolarity test. This type of test measures the composition of particles and water in your tears. With dry eye disease, there will be less water in your eyes. Tear samples to look for the markers of dry eye disease include elevated matrix metalloproteinase 9 or decreased lactoferrin. It's the human tendency to run after the home remedies when they are available to cure a disease or problem. If you don't know about any such home remedies to cure dry eyes, then we got you covered here. Further in this video, I'm going to tell you about some home remedies that we can try to recover your dry eyes. There is a substantial body of data including omega-3 fatty acid supplementation can benefit patients with dry eyes. In order to notice a change, patient must take these supplements on a consistent basis for at least 3 months. If environmental factors are causing your dry eyes, consider adopting some lifestyle adjustments such as avoiding cigarette smoke and wearing eyewear when doing outside activities when it's windy. Adding a humidifier to your home can put moisture in the air, which may help to reduce your dry eyes. A simple thing like blinking more often can relieve your dry eyes to some extent, especially when you are using a lot of screen, and concentrating on your TV, phone or laptops can compromise your blinking rate, and this alone could be the cause of your dry eyes. Take frequent break during the computer use. A good rule of thumb here is to look away from your screen at least every 20 minutes and look at something that is at least 20 feet from your eyes for at least 20 seconds. Eye doctors call this 20-20-20 rule, and abiding by it can help relieve dry eyes and computer eye strain. Thoroughly remove eye makeup. Eyeliner and other eye makeup can clog the opening of the glands at the base of the eyelashes, leading to meibomian gland dysfunction and evaporative dry eyes. At the end of the day, be diligent about removing all makeup from the eyelids and eyelashes. Clean your eyelids. When washing your face before bedtime, gently wash your eyelids to remove the bacteria that can cause blepharitis and meibomian gland dysfunction that lead to dry eye syndrome. Apply a warm, moist washcloth to your closed lid for at least 20 seconds. Then gently wash your lids and lashes with a mild cleanser, such as diluted baby shampoo or pre-moistened eyelid wipes. Wear quality sunglasses. When outdoors in the daylight, always wear a sunglass that blocks 100% of the sun's UV rays. For the best protection, choose sunglasses that can feature a wrap-style frame to protect your eyes from wind, dust, and other irritants that can cause a worsened dry eye syndrome. Warm compresses over the lids can open up all your oil pores and help in soothing your dry eyes. Not only that, gently massage over the lids can help in generation of oil and moisture from your lids. These are all the home remedies that you can use to treat the condition of your dry eyes. There is another better way to treat dry eyes, which is to add supplements to your diet. Here's the list of what you can add to your diet. Ground flaxseed or flaxseed oil, palm oil, soya bean oil, chia seeds, fatty fish including salmon, tuna, sardines and mackerel, walnuts, eggs that have been supplemented with omega-3 fatty acids. If all of the above remedies and supplements do not help to cure your condition, then you must go for the clinical one. There are various methods to cure the dry eyes. Artificial tears. Eye drops that increase your eye moisture are among the most common treatment for dry eye syndrome. Artificial tears also work well for most people. The doctors may also recommend to use some eye drops to recover from the syndrome. Many of these products have chemicals that aid in moisture retention. A typical calming component is CMC, carboxymethylcellulose. Soothing ingredients vary by manufacturer, and the brand choice is often a matter of personal preference. Consider these factors when selecting an over-the-counter product. Preservative versus non-preservative drops. Preservatives are added to some eye drops to prolong their shelf life. You can use eye drops with preservatives up to 4 times in a day, but using the preservative drops more often can cause eye irritation. Non-preservative eye drops comes in package that contain multiple single-use vials. After you use a vial, you have to throw it away. If you rely on eye drops more than 4 times a day, non-preservative drops will be safe. Drops versus ointments. Lubricating eye ointments coat your eyes, providing long-lasting relief from dry eyes, but these products are thicker than eye drops and can cloud your vision. For this reason, ointments are best used just before bedtime. Eye drops can be used at any time and won't interfere with your vision. Medications. The most commonly prescribed medication for dry eye syndrome is an anti-inflammatory called cyclosporin. Instead of over-the-counter artificial tear or in addition to them, your eye doctor might recommend daily use of prescription eye drops called Restasis or cyclosporin for your dry eye treatment. It does more than simply lubricate the surface of your eye. It includes an agent that reduces the inflammation associated with dry eye syndrome and help your body produce more such natural tears to keep your eye moist, comfortable and healthy. It's important to know, however, that the therapeutic effect of cyclosporin eye drop is not immediate. You must use the drops daily for a minimum of 90 days to experience the full benefit of this dry eye treatment. Some people who try Restasis will experience burning eyes early during the first few weeks of treatment. The drug increases the number of tears in your eyes and lower the risk of damage to your cornea. If your case of dry eye is severe, you may need to use corticosteroid eye drops for a short while medication takes effect. Alternative medications include cholinergics such as pilocarpine. These medications help stimulate tear production. If another medication is causing your eyes to become dry, your doctor may switch your prescription to try to find one that doesn't dry your eyes. Using special contact lenses. Some people with severe dry eyes may opt for special contact lenses that protect the surface of eye and traps the moisture. These are called scleral lenses or bandage lenses. Surgery. If you have severe dry eye syndrome and it doesn't go away with your treatment, your doctor may recommend surgery. The drainage holes at the inner corner of your eye may be permanently plugged to allow your eyes to maintain an adequate amount of tears. There are new treatments such as LipiFlow, which helps tear flow more easily, and BliffX, which is performed by an eye care professional to clean the eyelids. Punctal plugs. Punctal plugs sometimes are used in dry eye treatment to help tears remain on the surface of eyes longer. A punctal plug inserted in the tear duct of your lower lid to keep the eye tear film from draining away too quickly. A punctal plug is a small sterile device that is inserted into one of the small openings of the tear drainage ducts that are located in the inner corner of upper and lower eyelids. After these openings have been plugged, tears can no longer drain away from the eyes through the ducts. This results in tear film remaining intact longer in the surface of the eye, relieving the dry eye symptom. So where do the tears drain now? Usually they'll simply evaporate from the eye surface without symptoms. But if insertion of punctal plugs cause the watery eyes, one or more of the plugs can be removed. LipiFlow. The LipiFlow thermal pulsation system is an automated in-office dry eye treatment that combines the best features of warm compresses therapy and meibomian gland disc expression. The patented device fits over the eyelids and applies precisely controlled heat to the lid to soften the hardened meibum trapped in the meibomian glands. At the same time, the LipiFlow system applies pulse pressure to the eyelids to open and express the clot system, thereby restoring the correct balance of oils in the tear film to relieve the dry eye syndrome. LipiFlow per eye. In a clinical study of the effectiveness of the procedure, 76% of the patients reported improvement of their dry eye syndrome within 2 weeks of treatment. In some cases, however, it can take a few months for the improvement from the LipiFlow procedure to become apparent. Typically, the beneficial effects of LipiFlow procedure last 1 to 3 years or longer. Potential side effects from LipiFlow dry eye treatment includes corneal abrasion, eye pain, swollen eyelids, eyelid irritation or inflammation, transient blurred vision, itching and red eyes. LipiFlow dry eye treatment typically is not covered by health insurance. Fees for the procedure can vary from one practitioner to another and averages about $900 per session. IPL. IPL therapy is designed to address the meibomian gland dysfunction, the root cause of evaporative dry eye. IPL harnesses the power of light to send precise energy to break down any blockage in the meibomian gland in the eyelid. IPL can also reduce inflammation to improve gland function in the eyes. These are all the methods that your eye specialist will recommend to you in case you are diagnosed with a dry eye. This takes me to another topic, which is the risk factors that are associated with dry eyes. Some eye problems are not as simple as they look. They come along with many other problems that keep a connection with your eyes. The same happens with dry eyes. Dry eye syndrome is more common in people aged 50 and older. It is estimated that there are 5 million Americans in the age group with the condition. The majority of them are women, but the condition does occur in men. Women who are pregnant, on hormonal replacement therapy, or going through menopause are more at risk. The following underlying condition can also increase your risk: chronic allergies, thyroid disease, or other conditions that push the eyes forward. lupus, rheumatoid arthritis, and other immune system disorders, exposure keratitis, which occurs from sleeping with your eyes partially open, vitamin A deficiency, which is unlikely if you get the sufficient nutrition. Some believe that too much exposure to the blue light that is emitted from computer screens can contribute to dry eye syndrome. So it is a good idea to take breaks when using a computer. Some people feel more comfortable wearing blue light filtering glasses when using computers, and that won't cause any harm, I suggest. This is everything that you need to know about the dry eye syndrome and its treatment. I hope you have extracted some valuable knowledge from this video. If you have ever experienced the same, you can let us know in the comment section. If you like this video, do hit the like button and subscribe to our channel for more informative notes about the eyes. Also, do share this informative video with your family and friends. Thank you.